Welcome back to, and thanks so much for joining us here on America's Retirement Headquarters, home of the Retirement Guys Formula, America's Medicare Associates, and Retirement Tax Partners. ARHQ.com is the website. 419-794-3030 is the phone number. Don't forget, if you missed previous segments of the show, the first half of the show, you just want to catch up, all available via podcast, video on demand. Just go to YouTube, Spotify, Apple Podcasts, wherever you consume your media. Search for America's Retirement Headquarters. All of that is there for you to check out at your leisure. 'Tis the season means something a little different after the holidays. Right now it means, well, in just a couple of weeks, some tax filers are going to find out that they have to end up paying a higher premium for Medicare, and others may end up losing some or all of their tax credit. Higher income levels can trigger Medicare premium surcharges under the Income-Related Monthly Adjustment Amount, also known as IRMA. And since the Affordable Health Care Act is based upon income, let's talk about this. How do we reduce that? What are 4 ways to lower healthcare costs in 2025?
Well, boy, this is a good one. One of the things we've talked about the Medicare, and the annual enrollment period is October 15th through December 7th. Well, on the proverbial Unaffordable Care Act, that actually starts November 1st and runs through December 15th. So I'm going to go through, Nolan and I are going to go through actually 4 different key points, and we're going to talk a little bit about how to pay attention and to what you currently have, and how we can try to reduce some of your costs for 2025 for healthcare, whether it's Medicare or whether it's the marketplace plans. First and foremost, you want to make sure that you do, if you haven't already, make sure you do a review of your current plan. With the marketplace, you need to go in. You don't have to do this at the open enrollment period for the marketplace, but you should definitely go in, log into your account, and update your application. What this is going to do is even if nothing changed, what it's going to do is it's going to give you the new premium tax credit amounts that are available to you. One of the things that happens with the marketplace is, and don't shoot the messenger, we're dealing with the government here, okay? One of the things that happened is they increased the subsidy amounts. And here's what I mean by that. If, let's say, for example, you were reporting $50,000 of annual income, in 2024, that $50,000 may have generated, and I'm picking a number out of the air, $500 tax credit. That same $50,000 income in 2025 may generate $625 tax credit. So if you do not go in and update your application, you won't be able to take advantage of the $125 increased subsidy. Now, the other thing that happened was they actually lowered the maximum out-of-pockets. Not by a whole lot, but they lowered the maximum out-of-pockets. In turn, they also increased the premiums. So for the marketplace, update your application, make sure that you're taking advantage of the premium tax credits, and see how that coverage is actually going to work for you moving forward. There are roughly, in our area, Northwest Ohio area, there are roughly 102 different plans available, so you want to make sure that you go in and shop appropriately for that. One of the things that I do and our team at America's Medicare Associates will do for you is we eliminate 100 of those 102, and we'll focus on a couple of plans that are going to be best for you. So that's one thing. Understanding your coverage. This is a big one. A lot of people don't truly understand exactly what their coverages are and how to use them. Let me give you a perfect example. If you have, let's say, a rash of some sort, you don't necessarily have to go to the emergency room for that. A lot of people use the emergency room as their primary care. Well, you got to remember, you've got a copay for emergency room. And if you're on a plan that's got a higher copay for emergency room than it does for the urgent care, you might want to consider going to an urgent care facility and take advantage of that lower copay for something minor. You know, if you've got a minor cut or a cold that you just can't get rid of, things of that nature, you might want to reevaluate where to go seek treatment and see what's going to be best for you there. So those are a couple of things. Nolan, number 3 on our list is plan large withdrawals from retirement accounts with a tax what-if analysis. Why don't you talk about that for a second?
Yeah, again, a really good idea to understand how one thing can impact the other. So, the decisions on taking withdrawals from retirement accounts could impact your health insurance cost. It could impact your Medicare premium. It could impact the taxes that you pay on Social Security. So it's one of those snowball effects that really catches people off guard. A common thing that we will talk to people about is the goal of being debt-free. If I think about my clients in retirement time, I would say the ones that I know that are out there living their best lives ever, one of the consistent themes is, they're debt-free. So if you have a mortgage, a common thing that people will think about is, hey, maybe I want to pull a lot of money out of my retirement account and pay my mortgage off. I can think of some people that came into our office. They had already made that decision before meeting with us, and they came in and they found out that large withdrawal created that Medicare excess premium tax, costing them a lot on their healthcare expenses. When we're doing the tax what-if analysis, I generally agree that being debt-free is a good idea. But what they might have wanted to do was, say, stretch out the withdrawal over 2 years or over 3 years.
Right.
So it could have been a lot better financially for them had they taken, let's say, half of the withdrawals last year and then half of the withdrawals now this year. And that could have been a great way to help lower their healthcare costs in 2025. We also have people that will want to take large withdrawals for things like a client in particular that I can think of. They're taking a 3-month cruise around the world. Mm-hmm. I mean, what a wonderful lifetime trip. And, whether it's a Viking River cruise around the world, whether it's that dream car that you wanted, maybe a vacation or something else that you wanted, it may be more beneficial to consider how those large withdrawals are taken, again, by having that what-if analysis, because that income gets stacked on that year's tax return, could push you not only into a higher tax bracket, but could negatively impact the cost that you're paying for healthcare as well.
Yeah, absolutely. And that's one of the things on number 4 is watch your accountable income levels. What we do, and one of the things that is so great about our relationship is many, many years ago, I would say, let's see, the kids are, gosh, they've grown. They're 21 and 22 now, right? When our 2 kids were in Taekwondo together, we sat and struck up a conversation. And, hey, Nolan, what do you do? And he says, I'm a financial planner. I help people through retirement. I go, well, that's funny. I'm in insurance myself. And we just hit it off. And one of the things that allows us to really work well together is you'll come to me with a client's needs and said, where do we need to be for their reportable income? So I'll run an analysis for their health care and say, this is what looks good at this income level. Here's where we might need to get them. So one of the things that you're able to do is maybe take some money out of Roth IRAs to supplement some of that income, because Roth IRAs are not reportable income when it comes to health care premiums. So make sure that we do our best to try to lower your reportable income. Now, that's your reportable income to take advantage of the premium tax credits. One more thing I'll add before we end this topic here is one way to kind of monitor and cut some of your cost is your prescriptions. A lot of people get their prescriptions filled on a month-to-month basis. Well, if you do a 90-day supply and even consider maybe possibly mail ordering those, that's another way to save, because typically what happens is a 90-day supply is going to save you a full month worth of co-pays for those medications. So if you want to know how can I save on my healthcare costs for 2025, give us a call, reach out to us, visit our website. We've talked about helping people navigate and move through their insurance premiums and cut costs as much as possible for 25. We can help you do that.
I think it goes without saying, less money that you're spending on copays and doctor's visits and your premiums is more money you get to enjoy for yourself and utilize for whatever it is that you want to do. It's all part of the planning process, and you can figure out how it all works together by giving a call, 419-794-3030, or or visit them on the website, and that is at arhq.com.